It has to have such a fabulous wiring between the brain, the spine, and all the rest of the bits around there for it to function in such precision. So that is where I think people have misunderstood the prostate and not given it enough airtime.
Correct. It's always the question is like, what does it actually do?
Yeah.
Gives a little bit of fluid to it. But the fluid is, I think the fluid is more alkaline so that it protects the sperm, for example, because the vaginal fluid is more acidic to protect against bacteria and infection. So it is really incredibly complex and smartly done.
And very smartly done too.
Yeah.
So this little thing which is so highly wired, obviously, if it gets injured or damaged, there can be a lot of collateral damage. So our entire understanding of prostatic diseases has been to manage the collateral damage. It was never.
What do you mean by collateral damage?
So if you have a prostate which is inflamed, for example, it's the glandular part which is inflamed. Now, 30% of the prostate in the central part is muscular.
Yeah, I think that is very important that we are making that it's not just a gland with the same tissue.
No. It's got two distinct tissues, gland and the muscle. Mm-hmm. So the muscle obviously is in the center because, as I told you, it helps with continence, right? So that, and of course, the pushing of the fluid out, so it needs muscular tissue. So when you have inflammation of the gland, the muscle obviously goes into a spasm. Most of the time.
Yeah.
That spasm then makes it difficult for you to pee. But that's not enlargement now. It's inflammation causing that so-called symptom. And what is the regular treatment for this? Give you a muscle relaxant. How does that help? It takes away the symptom, maybe, to a certain extent, but it has not addressed the root cause. And that inflammation just goes on, and then it leads to other things.